Socialized medicine in crisis. There's a new story here coming out of the Hamilton region about a shortage of medical supplies. Ontario Health at Home so low on equipment that appointments are being canceled and some patients are being deferred to urgent care or ERs. A Hamilton woman said she had to buy her own medical supplies to get her dressing changed after cancer surgery because of a province wide shortage of home care equipment that local nurses are calling a crisis. This is just one of the many problems with the system of socialized medicine. We've been seeing the collapse of the Canadian healthcare system over the last few decades. Today, this year, uh, estimates range between 5 to 10,000 people dying every year, waiting to see doctors, to see specialists, to get access to MRIs and other diagnostic tests. You've got emergency rooms that are just completely overrun. People are waiting 10, 20 hours just to see a doctor. They're getting they're getting diagnosed in closets, in broom closets, and because they don't have the space, they don't have the capacity, because the system of socialized medicine is rigid, it's unflexible, it does not handle changes in demand very well. This is a very serious problem, and if people can't get treated at home, they don't have the supplies to treat them at home, they're going into the ER, they're going into clinics. That's just going to mean longer waiting lists for people that are trying to get diagnosed or that need the assistance of the doctor, whatever they need. So, what happened? Why is there a shortage of equipment here? And so it goes on in the article to say that the agency, Ontario Health at Home, switched to a new provider, and they've been having this issue with shortages ever since. So it seems to me like somebody wanted that juicy government contract and they bit off more than they can chew. So this seems like a terrible decision when you have a system that was working all right, and then they switch over to these new guys, all of a sudden they can't do the job. And I think that's part of the problem with when you have the government doing something as opposed to the market economy. Because if this was handled by businesses instead of the state, they probably wouldn't have sole source providers. And if the sole source provider couldn't step up to the plate, they would be dropped and probably sued for breach of contract, failure to supply. So it seems like the bureaucrats that are in charge really dropped the ball here. I wouldn't be surprised if there was some graft involved, if this new supplier, greased some palms, or even if it wasn't outright bribery, there was some preferential treatment going on there. I mean, it seems like the old guys at least were getting the job done, and these new guys, they can't do the job, so obviously they shouldn't be doing the job. And this is just terrible for the patients who they're dealing with cancer, they're dealing with serious illnesses, being treated at home. They can't even get basic medical supplies. We're supposed to be a first world country here, people. And then the minister says, if you haven't received supplies, here's a number you can call. Like that's going to do anything. Anyway, bottom line, Canadian healthcare system, it's broken. What we really need is a free market in healthcare. Get rid of the government involvement, get rid of this socialized medical insurance, and just have markets. Markets work, socialism doesn't. With socialism, you're always going to end up with problems like this, with shortages, with inefficiencies. That's why we see huge waiting lists in ERs, and so many people who are waiting to see doctors. There's so many stories like that of Allison Holthoff, who died in the hospital uh, while waiting in the ER for 7 hours, did not receive treatment, and she's there. She's in extreme pain. She can't even stand up. They decide she's not a priority. They triage her into the waiting room, don't even let her see a doctor. And, part of the problem is there's so many people, they don't have family doctors. They have to go to the ER. The waiting lists are huge. And people fall through the cracks all the time. We have a very high bounce rate for ER visits in Canada. We've got very few doctors per 100,000, very few hospital beds per 100,000 compared to other OECD nations. Our healthcare system is in a shambles. People are literally dying while they wait for medical treatment. It's not right. Things need to change.